I was very amazed in terms of how agile the team was last year. And what I mean by that is, during a dire time and uncertainty, the team were able to create opportunity. And what we did as a team was we leveraged the idle staff in the hospitality industry and placed them with jobs in the e-commerce and logistics spaces where they realized huge demands and they were short in staff. So that was a huge social impact that we did for the community. And at the same time, we were able to really thrive during COVID. I mean, we grew about 24% last year versus the year before, which is a great indication in our ability to kind of adapt in uncertainty. But the main thing that interested me, due to COVID was the impact that it had on the sector. So as a sector-wide, we have seen accelerated adoption in the gig economy amongst all the stakeholders. So the supply side, the demand, and the governments. So on the supply side, we are seeing a lot more supply emerge, so a lot more people that are now becoming less dependent on full-time jobs and look for multiple work and have that flexibility to sort of control their schedule and diversify their sources of income. On the demand side, we're seeing a lot of businesses now leverage the gig economy to quickly man up their operation, open up their business, and at the same time are looking for more of a flexible means to weather their seasonality or fluctuations in business. So just to give you an example, in the hotel segment, I've been for the past 4 years trying to educate the hotel segment that are very pro sort of full-time hiring to hire sort of part-time staff. And now we have acquired 10 times more hotels this year alone versus the entire 4 years. So we're seeing an accelerated adoption on the demand side as well towards part-time staffing. And on the back of that, you've got governments as well that are gearing themselves to facilitate regulation and ease part-time work within these communities.
My name is Emilian, and I'm the CEO and co-founder of Ilara Health, based in Kenya and South Africa. Yeah, I think one would expect that the biggest impact during the pandemic would have been awareness of individuals, the same way as it happens here or in the more developed side of the world. However, we're in Africa, where there is very little awareness about really the health of individuals, and there is very little money to pay for healthcare. The biggest impact was really the awareness and the awareness of the partners, of the society, of insurance companies, of founders, of investors. So the world has awakened and said finally healthcare is extremely important, right? It's about life and death. If we don't do something about healthcare, and if we don't use technology to improve the way the healthcare has been delivered, mainly at the primary care level. So I'm not talking about the big hospitals, I'm really talking at the base where most of the people go and seek care. So it's really the awareness of all those different partners which make this ecosystem eventually work.
My name's Asim Janjua, I'm the co-founder of Mamo. So I think from a positive perspective, it's really brought people together inside an organization, especially at Mamo. We're very keen on building a delightful culture internally, and I think the pandemic allowed us to appreciate and pay gratitude to what's important in life, and that's brought everyone together, which has ultimately reflected on the business as a way of productivity, focus. Yeah? I think the pandemic has also slowed things down a little bit, which allowed us to kind of think more acutely about what we're doing and how we're doing it as well. And that slowdown allowed us ultimately to build a much better product.
The biggest positive impact, I would say, is the change of perception amongst the right stakeholders that we were trying to target. So, and the patient amongst them, right? So it's the patient, the insurance company, the government, the pharma company, all these different stakeholders that we were trying to pitch digital health or telemedicine to. They were somewhat convinced, but not as convinced as, post-COVID, because generally the perception was the doctor needs to, tap on my knee or my chest to figure out what my vital signs are, right? But today we tell them, these are just data that we're measuring and we're sending to the physician. So whether he's right in front of you or on a screen behind in his own home or office, it's the same thing, right? So that reduced the sales cycles with insurance companies. It increased appetite amongst pharma, and it made the patient more willing to basically try and dare and attempt and do a telemedicine consultation.
Our business is out of Egypt, and in Egypt we had like a 2 or 3 month lockdown period, and in that period conversations basically slowed down with companies. We were selling a benefit at the end of the day to the companies, so we had an impact on our ability to acquire new companies. But we used that period to basically regroup and rethink. So we regrouped our internal team, our internal KPIs. We rethought a lot of things about the product, and we had the time luxury to focus on how can we prep for the next phase when the companies are ready again to have the benefits conversation. And that, luckily for us, happened very quickly in Egypt, because the lockdown was lifted 2 or 3 months into the pandemic. And this allowed us basically to grow our number of transactions and our amount of transactions hugely after the pandemic.